Hello everyone. Today we're going to talk about one of the most incredible, yet often overlooked organs in our body, the liver. Did you know that your liver filters an astonishing 5 times its own weight in blood every single minute? It's a remarkable chemical factory, working 247 to keep you alive and healthy. But what happens when this vital organ starts to fail? What signals does your body send? The important thing you need to know is that the liver is often called the silent organ. Why? Because even when damaged, it often doesn't show symptoms until the problem becomes serious. However, your body does send subtle but crucial warning signs when your liver begins to deteriorate. Catching these signals early could prevent more severe health issues down the road. Now, let's explore the 7 early warning signs that your liver might be in trouble. 1. Persistent fatigue and low energy. Have you been feeling constantly tired despite getting enough rest? This unexplained fatigue could be a sign of liver dysfunction. Scientifically speaking, your liver acts as an energy storage facility for your body. It stores glycogen and converts it to glucose when needed to fuel your activities. Recent research shows that approximately 80% of patients with impaired liver function experience chronic, unexplained fatigue. Particularly concerning is when you wake up already feeling exhausted or experience extreme tiredness throughout the day despite adequate sleep. What's even more surprising is that this fatigue typically becomes noticeable only after liver function has decreased by at least 30%. This means that by the time you feel abnormally tired, your liver may already have sustained significant damage. But don't worry if caught early. Liver function can often be restored through appropriate lifestyle changes alone. 2. Unexplained weight changes. Sudden weight fluctuations can be an important indicator of liver problems. Pay attention if you're losing or gaining weight rapidly without changes to your diet or exercise routine. When your liver isn't functioning properly, protein metabolism is affected, which can lead to muscle mass reduction. According to one study, approximately 30% of patients with early liver disease experienced weight loss of more than 5% within 6 months. On the other hand, as cirrhosis progresses, a condition called ascites can develop, the accumulation of fluid in the abdomen. This can cause sudden weight gain and abdominal distension. Astonishingly, in severe cases, ascites can lead to weight gains of more than 10 pounds in just 2 weeks. If your weight is changing rapidly for unexplained reasons, it's worth checking your liver function. When caught early, these weight changes can be completely reversed. 3. Digestive discomfort and abdominal pain. Your liver plays a crucial role in the digestive process. It produces bile to digest fats and helps metabolize nutrients. When liver function declines, various digestive symptoms can emerge. Specifically, you might experience discomfort or pain in the upper right abdomen after meals, frequent nausea, indigestion, or increased gas production. Interestingly, digestive discomfort due to liver dysfunction typically worsens after consuming fatty foods. Recent studies indicate that about 50% of patients with early liver disease experience these digestive symptoms, but most dismiss them as simple indigestion. If you notice recurring pain in your upper right abdomen within 2 hours after eating, it might be time to check your liver function. Even more shocking is that these digestive symptoms are often misdiagnosed as stomach problems, leading to incorrect treatment. Be careful not to mistake liver issues for stomach problems, as this could delay proper treatment. 4. Yellowing of skin and eyes. One of the most well-known signs of liver damage is jaundice, the yellowing of skin and the whites of the eyes caused by the buildup of bilirubin, a yellow pigment in the blood. A healthy liver processes bilirubin and removes it through bile, but when liver function deteriorates, this process is compromised. The scientifically fascinating aspect is that for jaundice to become visible, blood bilirubin levels must increase to at least 2.5 times the normal level. What's crucial to understand is that subtle changes can occur before jaundice becomes obvious. For instance, your skin might take on a slightly yellowish tint, or the whites of your eyes might appear faintly yellow. These early signs are best observed under natural light with a mirror. Additionally, jaundice due to liver disease is typically painless, which makes it more dangerous. Painless yellowing is a significant warning sign that requires immediate medical attention. 5. Itchy skin and other dermatological changes. Liver dysfunction often causes various skin changes. In particular, persistent unexplained itching can be an early sign of liver disease. From a scientific perspective, when the liver is damaged, bile acids and other toxins accumulate in the blood and irritate skin nerves. This typically presents as generalized itching that worsens at night. Research shows that approximately 70% of patients with primary biliary cirrhosis experience itching in the early stages of the disease. Another skin change is spider angiomas, small red spots with spider-like blood vessels radiating from them. These typically appear on the face, neck, and upper chest. Even more surprising is that itching due to liver disease often occurs without visible rashes or lesions on the skin, unlike typical skin conditions. This is why it's frequently misdiagnosed as simply dry skin or allergies. If you experience unexplained itching that worsens at night, consider getting your liver function checked. 6. Signs of hormonal imbalance. Your liver plays a vital role in hormone metabolism. When liver function declines, hormonal imbalances can occur, leading to various physical changes. For men, gynecomastia, enlarged breast tissue, can develop. This happens when the liver can't properly metabolize estrogen. Studies indicate that about 30 to 40% of male patients with chronic liver disease experience some degree of gynecomastia. For women, menstrual irregularities or even amenorrhea, absence of menstruation, may occur. Additionally, both sexes might experience decreased libido. The most shocking fact is that these hormonal changes are often misattributed to aging or stress, delaying the diagnosis of liver disease. Therefore, if you notice unexplained hormone-related symptoms, it's important to check your liver function. 7. Cognitive changes. Finally, liver dysfunction can surprisingly affect brain function as well. This is known as hepatic encephalopathy, which in its early stages can manifest as subtle cognitive changes. Specifically, you might experience decreased attention, reduced concentration, memory problems, confusion, or mood changes. Even sleep pattern disruptions can occur, particularly a reversed sleep cycle, where you're drowsy during the day and experience insomnia at night. Scientifically speaking, when the liver is damaged, it fails to properly remove toxins, especially ammonia, from the blood. As these toxins accumulate in the brain, they affect neural function. The most serious issue is that these early cognitive changes are often misinterpreted as stress, aging, or simple depression. Research indicates that approximately 60 to 80% of liver disease patients experience some degree of cognitive decline as the disease progresses, but most cases are overlooked in the early stages. If you notice concentration problems or unexplained mood changes that weren't present before, it might be worth checking your liver function. How to protect your liver health. We've now explored 7 early warning signs that appear when your liver begins to deteriorate. While these symptoms don't necessarily mean you have liver disease, it's important to consult a doctor if you experience several of them together. So what can we do in our daily lives to maintain liver health? First and foremost, limiting alcohol consumption is crucial. Alcohol has direct toxic effects on the liver. Amazingly, the liver is so resilient that it can recover from up to 70% damage on its own. However, recovery becomes extremely difficult beyond that point. Second, maintain a healthy diet. A balanced diet rich in fruits, vegetables, and whole grains is essential for liver health. Foods high in antioxidants like berries, green tea, turmeric, and garlic are particularly beneficial for liver protection. Third, regular exercise is vital for liver health. Research suggests that more than 150 minutes of moderate intensity exercise per week reduces liver fat and improves overall liver function. Fourth, maintain a healthy weight. Obesity is a major risk factor for non-alcoholic fatty liver disease. Losing just 5 to 10% of your body weight can significantly improve liver health. Fifth, avoid unnecessary medications. Many drugs are metabolized in the liver, and some can cause liver damage. Even common over-the-counter medications like acetaminophen can cause serious liver damage when taken in excess. Finally, get regular health checkups to monitor your liver enzyme levels. If you experience several of the symptoms mentioned above, request a liver function test.